Today we're going to work on improving your tibial rotation, specifically your internal rotation. Now maybe you feel this most when you're squatting, lunging, doing some lower body activity in a sense where perhaps you don't feel like you have as much range of motion. Maybe you also feel some pain in the knee and or the ankle. Let's get into how we can improve that today. So first, to assess this, you want to just be in a nice seated position, nice and comfortable, and see how far you can turn your foot inwards. Now you want to make sure you're not cheating. Common cheat is lifting your foot up so you can get in further. That's not what we're testing out here today. We're looking at the tibial rotation, so this lower, more shin bone. Keep the foot down, rotating as far as you can. And then back to neutral, then compare it to the other side. Probably going to find one is easier than the other, so let's go ahead and try to work on improving our symmetry first and foremost. Or as mentioned earlier, if you're feeling discomfort or locking up in any specific movement, let's start with that side. Now, in order to get into this, all we need is a band. We're going to put this band, so I'm going to improve my right internal rotation, my tibia. We're going to put this band to just start right near the base of your big toe. Not the tip, but actually a little bit further down. And we're going to place the band just underneath it. That way it's going to be a little bit more challenging. If you put the band on the other side of the foot or right in the center, you're going to be able to cheat a little bit too easily. So we're going to keep it locked into there. I'm going to remove the chair. Now that I have that band underneath my foot, make sure your foot is straight and neutral. I'm going to apply an outwards pressure. Just to show you, if I were to lift up my big toe, the band comes outward. That's the vector that we're pulling in. So again, place this just under that big toe, the base of the big toe, not the actual toe itself. Pull outwards just to get some tension. And now what we're going to work on, keep that tension as we drive our knee outwards. We're going to be going for reps to technical failure. As far out as you can, bring it back in. When you're doing this, you're activating your glute, the posterior hip muscle. So you're going to feel that one really fire up. Now, remember to keep your foot straight, driving that knee out as far as you possibly can. This is going to help improve our internal rotation in those movements we discussed. Now, just to demonstrate, once I get to technical failure, it might look something like this. The band comes out. So consider how many reps you did, write that down, keep at this every day, try to do this twice a day at least, and start to progress slowly but surely. Now, if you're noticing that that's too challenging, you don't have as much foot control to keep that band there right off the beginning, here's a little regression for you. You can put your foot up on the stable surface. You're going to grab the back part, so the heel, just lock it in with your hand, and then your midfoot, lock it in there as well. And we're going to focus on improving that same movement, taking my knee out as far as I can. Using that glute, really firing through there. Again, to technical failure. So for this, since there's no band, technical failure, that's going to come when you just feel like you can't do anymore because your glutes are so burnt out. So look at that from the front. Locking down my heel, locking down the midfoot, and taking it out as far as I possibly can. And doing this until technical failure. Now, to make sure you did things the right way, afterwards, get yourself back into that same starting position and compare. Let's see how much your internal rotation has improved. All right, happy squatting. Take care.